Joe.
And I'm Ian.
Welcome to the Models Are Wrong podcast. We're both applied maths PhD students at the University of Edinburgh, and we're interested in mathematical modelling and the use of them in decision making. By mathematical modelling, we mean the description of systems using mathematical concepts and language, and they're used to explain systems, the effects of the different parts of those systems, as well as to make predictions. However, this last point is something that we'll speak about in more detail in the episodes of this podcast, because it's quite interesting. Everyone listening will have experienced the impact of mathematical modelling through policy decision in the handling of the pandemic. While this is the most prominent recent example of mathematical modelling's impact on the world, there are many and varied applications, such as in economic modelling, modelling of social systems, predictions of weather and crime, as well as even our psyche and its interaction with social media.
Yes, so in this series of interviews and conversations, we will be exploring the societal impact as well as the internal workings of modelling as applied to real-world systems, a couple of examples Joe has given. In this episode, our first, we will be speaking to someone very familiar with the modelling to decision-making pipeline, specifically the government response to the COVID-19 pandemic. Mike Tildesley, you are part of SPI-M at Warwick. Now let me get my acronym dictionary out. Systems Biology, Infectious Disease, Epidemiology Research, as well as member of SPI-M, which is Scientific Pandemic Influenza Group on Modelling. I guess just to start off, can you just kind of outline what that role is in terms of the hierarchy of, we hear a lot about SAGE and things like that. Could you just outline how that sort of works?
Okay, so SPI-M is the modelling subgroup of SAGE, and it has existed actually for many, many years. Now, in peacetime, as it were, this is normally a fairly small group of individuals who maybe meet several times a year just to discuss kind of pandemic preparedness and the use of models and so forth. Since just over 12 months ago, it's expanded quite significantly in size and scale. There's now something like 60 to 70 people that sit on SPI-M, and we meet every week. Now, SPI-M is involved in many things, many weekly things, like the calculation of the R number that's published every Friday. That's carried out by multiple modelling groups within SPI-M. Also, really looking at kind of responding to any really important asks of the government. So, just about 12 months ago now, we were working quite a lot on reopening of schools, looking at sort of strategies for children to get back into the classroom into the summer. There was work over the summer last year looking at, circuit breakers was a big thing, which I'm sure you're aware of, that kind of made quite a lot of press coverage that SPI-M were heavily involved with. Obviously, the November lockdown, then looking at Christmas, which again was a big thing just before the new year. And of course, more recently, we've been heavily involved in optimal rollout of the vaccination campaign and also the roadmap in England back to normality, as it were. As you will know, the decisions are devolved. We do work with the devolved administrations, but primarily a lot of the work that SPI-M's doing is actually feeding through into English decision making, though there are representatives of the devolved administrations that do liaise with SPI-M as well.
Okay. And so how does this, these SPI-M things, how do they, you said it expanded. Who makes the decision as to how many people will be in it and who exactly?
Yeah, and I'm afraid I'm not party to that, and it's not something I'm aware of. I think, it very much exists as a need. So if there is obvious need for particular academics with particular areas of expertise to be involved, then of course they will be co-opted on. And I mean, even in my time, I've been on SPI-M for just over a year now. I think it was late March last year that I started to get involved. It's expanded even from then, that if we have had particular academics who maybe have expertise in, say, vaccination deployment, or looking at, say, models, network models, which have been used quite a lot for, say, our universities' work, then, there's various people that have been co-opted on. So there is a chair of SPI-M, co-chairs of SPI-M that are Graham Medley and Angela McLean, who really kind of oversee everything. And then it's sort of managed by a secretariat as well, who have various different levels of expertise, various different areas of expertise within that. So that's kind of how the structure works. But there are, I would say, with the academics within SPI-M, whilst the vast majority of academics are kind of infectious disease modelers, they do tend to focus upon very specific areas. And you maybe you're heavily involved in multiple areas. I've done quite a lot on education, for example, and I've been involved a little bit in some of the large events work that's been going on. There are others who work very heavily on, say, every week they will develop a model that will calculate R. And then some groups are involved in the roadmap work and will be working really, really intensively at the moment on that. So whole bunch of academics, but I think within that, there's very much kind of people who are looking after one particular area or other. Okay.
And you say that you meet every week. What format does that take? Like, is it, there's sort of different subgroups of this SPI-M. Do they each kind of present what they...
Now, I have to be a little bit careful here, Ian, because I'm not allowed to talk about what happens on SPI-M meetings.
No, yeah, that's completely understandable.
We meet every Wednesday, and I mean, the things I can talk about, the things that very much go into the public domain. So, obviously we do have discussions about multiple model forecasts of the R numbers and growth rates and so forth, and they get put into a consensus statement that gets released every Friday. But there's no kind of consistent SPI-M meeting anyway. There's no kind of set format, because it will be whatever happens to be interesting will be discussed at the time. So it's very variable, dependent upon what is deemed to be a matter of importance on that particular week.
Is it possible to? How much can you say about how information comes together and feeds into SAGE? Because I think one of the topics we're really interested to speak about today is this kind of communication between mathematical modelers and decision makers. How that can be done optimally and how it can go pear-shaped, I guess. So can you speak to that at all?
Basically, so SPI-M don't directly communicate with policy. I mean, there are occasionally, we do have sort of direct communication. So, I work kind of with Department for Education sometimes, but generally it's a flow. So these subgroups of SAGE do sit below SAGE, as it were. So you have your SPI-M meeting, and then documents that it's deemed important will get escalated to SAGE, which then tends to meet on the Thursday. And then it may be that then beyond that, particular documents of importance might get escalated to Cabinet Office. So they are then sort of taken forward by, So, for instance, if I've presented some work on, say, universities, this may then get presented by one of my colleagues who sits on SAGE, or basically a shortened down version of it, and then it will be escalated if it's deemed to be necessary further up the chain. So that's sort of the way that the communication works. Not everything that gets presented at SPI-M will go to SAGE, and not everything that gets discussed at SAGE will be necessarily escalated through to policy. But it is very much hierarchical. Obviously it's important, actually, because it's important when we do communicate with policy that we communicate in a way that is understandable, that, we get across the kind of really important overarching points, and that it doesn't sort of get mired in kind of mathematical complexity. So this is why this kind of hierarchy works, so that when you're escalating a document, it is kind of user-friendly enough that it can be properly digested by policymakers.
Who decides which matters are important? Is it a chair, or is it like a consensus between SPI-M and SAGE?
I can't answer that question, Ian. I mean, it happens above my head, I'm afraid. I mean, we are informed if a document is going to go through to SAGE, we are made aware. And of course, at the point that I'm sure you're aware that the SAGE documents do eventually get published, and
yes,
we're made aware
that's one thing that has been very good. I think the transparency of the minutes and stuff like that has been very good. Go on.
And obviously, yeah, we are made aware at the point that these documents are going to be made public. Occasionally, there are certain elements that need to be embargoed. So if you're using sensitive data that you aren't allowed to put out into the public domain, then of course that needs to be taken out of the official documents that go public. I mean, we obviously have to be bound by any data sharing agreements that we've entered into, and we can't be pushing data out into the public domain. So those are sort of the caveats to that. But in terms of what's deemed important enough to go to SAGE, that obviously is presumably decided by chairs and secretariat in liaison with SAGE as to what they are most interested in at any point in time.
Oh, okay. So it's not up to SPI-M really in that it's SPI-M's role is to convey the information, and then then it's up to the people who intake that information to pick which parts of that is important to make the decisions that they're wanting to make.
Yeah, and at some point, I mean, you might have specific commissions. So you might be told that, in particular, we need to know about, say, the role of universities or strategies for reopening universities, for instance. So obviously was something I was looking after. And so that comes as a commission that at the point that you're putting it in that it's going to get escalated to SAGE because it's been actually commissioned directly. But it may be that, for instance, I decide, I want to do some work on economic impact of COVID or something, and I just, I submit it as an AOB to SAGE, to SPI-M, should I say, and it gets presented, and then that's the end. It's just kind of there for information for people. So it's very much dependent upon what you're discussing.
Right. I think it'd be interesting to explore a little bit about some of the things that can go wrong in terms of modeling and model-based decision making. So it's something that we've been very interested in thinking about is this distinction between predictive and qualitative modeling. And the communication of that to those who are reading a paper or taking a conclusion from a model and something like this. Perhaps I don't know whether you want to give your personal opinions too much when speaking about SPI-M, but maybe in general you could speak about what do you think that it's common for people to misinterpret models as predictive when really they were qualitative? And do you think perhaps it's whose responsibility does that lie with? Is it the modelers doing a bad job of presenting their work and making it out to be more predictive than it really is? Or what do you think?
Okay, so I can sum this up in a few words, which is apparently the inability to communicate uncertainty. And I think this has been the problem all along. And I generally think actually the science group are pretty good at this, that we're generally very good at when we do present a model result, you put uncertainty around it, you very clearly state what your assumptions are up front. And then all of a sudden you see that the media have reported, had we have locked down 3 weeks earlier, we could have saved 100,000 lives or whatever. And the models are not typically saying that. But first of all, there's always uncertainty around those. And secondly, of course, the problem is you are running these with, as you say, not as a prediction. Sometimes you're running worst case scenarios. And this is actually, this was one of the difficulties I had actually communicating this with the media back in November, that we were specifically asked to run what we called realistic worst case scenarios. And the key thing is not predictions, they are scenarios. And they are done specifically to allow like the NHS to plan for the worst, to make sure that they have enough hospital beds, they have enough intensive care beds or whatever, if the worst were to happen. And of course, these worst case scenarios always look horrendous. And then they go through to the media and then they are deemed to be predictions. So the modelling group are showing that come December, NHS is going to be overwhelmed. And it's like, we are not saying that. We are saying that if everything went wrong, if the transmission rates were very much the upper end of what we think is realistic, this is what would happen. Now, I don't know how much of that is these things getting misinterpreted or the media thinking it makes a better story if they present these really horrifying things. It's really, so I'll give you one really frustrating example of this, actually. So we had this around Christmas. We were asked to look at essentially what would be the impact of a 5-day relaxation over Christmas. And one of my colleagues did a really simple back of the envelope calculation that basically looked at, and you guys could do this, right, yourselves, but really all we were looking at was, you have an R number of, say, 1.5 over Christmas that then maybe goes down to 0.8 before or after Christmas. So, you can do all this with exponential growth. It's dead easy. And literally that's what she did. And based upon the parameters that she put in, she found that if you had to have, for one day of Christmas, it would be something like 4 or 5 days of lockdown after Christmas to recover essentially the growth that you saw over the 5-day Christmas period. But again, with your background, I'm sure I don't need to tell you this, right? This is highly dependent upon your parameter assumptions that go in. And it was purely presented as well, look, this is a sort of a toy model to show that actually, if you unlock everything over Christmas, then you're going to have to pay for it after Christmas. A few days later, this was in the press. 1 day of Christmas will cost us 4 days of lockdown or whatever. And they were stating as fact that this is what SPI-M had said. And it was all, again, simply because of an inability to understand uncertainty, or a perception that the public couldn't understand uncertainty. And it's hugely frustrating. I think this is the one thing that I've run into multiple times. And actually, I think it does the public a disservice, because I think, whenever I discuss this, I always make the analogy with weather. Like if we look at a weather forecast, I think we are very, very comfortable with the idea that tomorrow there is a 10% chance of rain. And you understand what that is. And you make your assessment as to whether you're going to go to the park or, whether you're going to go on a hike or take an umbrella with you or whatever, based upon that percentage chance of rain. And I think it's really odd, actually, that when it comes to the epidemic, it's deemed that the public don't understand uncertainty. I actually think they do. And I think actually, if we were able to state that uncertainty when these predictions go out, it would provide much more credibility for the model results as well. So that's difficult. The other painful thing that's similar is that, when the model predictions come out and they say, well, if you don't do anything, this is what you'll see, you then get criticism several weeks later after a lockdown where the press will come back and say, oh, yeah, well, you said there was going to be 100,000 deaths and we didn't see that. And it's like, yes, but that's because you locked down. And I think there's almost this, you're damned if you do and you're damned if you don't to some extent with the models. And it comes back to exactly what you said, Joe, because these are not predictions. These are not things that will happen. And there are various things that change from the point you make the prediction to the point that, the prediction would have come true, as it were, that influence the forecast. And I think that's what makes our job at the moment really, really challenging.
Yeah, that's interesting. You've touched on a couple of things that we've been discussing, especially one thing that rang true with what you said was like how communication with the public, there's communication with the news, there's communication with politicians, there's communications with the public, and those three things require very different skill sets on behalf of the scientist, and indeed very different skill sets on behalf of the person who it's being communicated to. I was just wondering whether you've seen a change in the way that scientists communicate with, especially the news. You see a lot more scientists in the past year, for obvious reasons, talking about these models, talking about these sorts of things. Do you see the role of scientists having changed over the past year? Will it just go back to how it was before? Or, could you just speak a little bit about that?
Yeah, I think to some extent that's true. I do think we're getting increasingly politicized, though. I think this has been, again, another really difficult thing that, you say something and all of a sudden, and again, speaking from personal experience, I had this a few weeks ago, right? I did an interview on the Today programme, and it was kind of my own fault, really, because I should have been much more careful with what I said. But I was asked about international travel, and I said something along the lines of, I think that international travel is going to be extremely unlikely in the summer, given all of the concerns about variants of concern. And I said a lot more than that, and I explained why, but I should have been much more careful of it. And then all of a sudden, I started to get all these hate mail from people in the travel industry, and I couldn't work out why. And then I checked, and it was the lead story on the BBC website that said, government advisor says international travel extremely unlikely in the summer. And it really puts you off actually engaging with the media because, first of all, I'm a nobody, right? Yes, I'm part of SPI-M, but as I've explained to you, it's a huge number of people on SPI-M. It's not like I, give Boris a call and have a chat with him and tell him what's going on. I have no direct link to government. Mm-hmm. When we talk in the media, we're talking about our own personal opinions. The very fact that I think that international travel may be unlikely in the summer means nothing. But of course, it's about the media wanting a story. And I think we're almost being weaponized to some extent, which is quite frustrating. I just want to go on and talk about the science. And when it becomes really political like that, I had someone that Monday, I had someone from the travel industry email me a screenshot of travel company share prices on Monday morning and showing them crashed. And they said to me, "This is your fault." And it's like, oh, it's crazy. If I had that power, God, I should have short sold a bunch of travel.
Yeah, exactly. Sounds like insider trading.
Yeah.
But it's really quite scary, actually, that all of a sudden, I started doing a little bit of media just over 12 months ago, and it's got to the stage now that most of the time I ignore my phone because it's going constantly. And I still do some, but I'm really trying to scale back simply because of this politicization that I really don't like. That they're looking for a story, they're looking for scientists to come on and say something, and they're almost not really interested in the facts. They're going to cherry pick from what you said so that they can get the biggest lead headline possible. In terms of what will happen after, I really don't know. I have found that the media are also very fickle. So when Prince Philip died a few weeks ago, all of a sudden, I didn't get contacted for a week. It was great. Not that I want, someone to die for me not to get contacted by the media, but you did realize that all of a sudden, because there was something else that was newsworthy, COVID was forgotten about for a week. So I think that will happen. I think eventually the pandemic will end and we'll all go back to obscurity and everyone will have forgotten who we are. So it's been a really odd last 12 months. And I think it's really hard, actually. I think in the main, actually, my interaction with the media has been really positive. I've had some really great relationships that I've built up with certain members of the media over the last 12 months. But unfortunately, there are those ones that don't go quite so well. And when they do, they're the ones that make big headlines. So it's a real challenge. And I've seen it, I think I've touched wood, I've had those couple of really high profile ones that have been really unpleasant, but touch wood, I've been okay. But I have, I'm aware that some scientists have got hung out to dry. In the situation with Neil Ferguson, right? I don't condone what Neil did whatsoever, but he's a scientist. And he should have been extremely careful and he should not have put himself in that position. But I think the way that the press hounded him was horrendous. And it really terrifies you, actually, that it makes you think, every step of the way, I've got to be really careful. It's not like, I'm sneaking out to go and visit my married mistress or whatever. But, you do have to be careful. You've got to think, if my parents are coming to visit my children, for instance, you've got to think, well, you better stay in the garden because if someone catches you in the house, then, I might end up making headlines, and it does make you think like that, 12 months ago, no one cared what I did. And I don't think, again, I've not got an overinflated sense of my own importance. I'm not on Neil's level, and I totally understand that. But actually, I think the media wouldn't care. So it's a really weird position.
If they can call you a government advisor, then you might as well be, I suppose.
Yeah, absolutely.
Yeah. I'm interested to touch on, so we've spoken quite a bit there about communication to the public via the news. And we've also mentioned communication with the public via the SPI-M documents being published. But I wanted also, and we certainly realize that uncertainty is very difficult to communicate with the public, or at least the news thinks that they can't handle it unless it's for weather. But do you think that politicians have also been criticised by different people? I think Dominic Cummings being one, for not understanding probability and not being able to handle these types of things. So do you have anything to, what would you have to say on communicating uncertainty and just communicating the science with politicians and decision makers? Do you think that's much better than the news, or do you think that it's the same set of problems?
You need lots of different coloured lines. Joking aside, I think it's better actually. So so Matt Keeling always tells the anecdote from Foot and Mouth 2001, that I may have told you before, Ian, so I do apologise if it's repeating. But so this is obviously 20 years ago now, but back in 2001, he tells a story whereby at some point round about April, when the peak was, the modelling teams were asked to project when the epidemic was going to end. And so they produced their forecasts, they produced kind of a mean line, and then the upper and lower 95th% confidence intervals. And then all of these had prediction intervals, should I say, and then all of these had confidence intervals around them. So there was a graph, very complicated graph with 9 lines presented on it that was presented to the science group. And again, I am not quoting directly, so this is very much kind of an anecdotal discussion, but then, it's very much decided that to present this to the chief scientific advisor, you couldn't have a graph with 9 lines. It was too complicated, so you had to just give them 3. And so they took off the confidence intervals, and so you just had the mean and you had the upper and lower prediction intervals. And then the chief scientific advisor looked at this and decided that Tony Blair could not understand a graph with 3 lines on it. You just had to give him 1. And so the graph that was sent through to Prime Minister had 1 line which predicted the epidemic was going to end on the 6th of June. And then this is what gets pushed out to the press. And it so happened, if you know your political history, it was an election year, and the date of the general election was the 6th of June. And so it was deemed that the government were basically sort of suggesting that the modelers could find a model that predicted that the epidemic would finish by election day. Now, this was clearly not true. This was clearly the case of all of the uncertainty had got buried because it was deemed that the policymakers couldn't understand this. I think we are, 20 years later, I think we're in a better place than that. And certainly when we do produce like our roadmap modelling, for example, we have, and I joke about various different coloured lines, but this is basically how we do it, right? We will have our sort of map, our timeline of the data up to a particular point, and then you'll have a bunch of different coloured lines which look at, well, a vaccine being 90% effective, a vaccine being 80% effective, and so on. And actually, I think that policy have got much better at understanding that. I think you do have to present it in a way that's palatable, and I think that's why these kinds of graphs are really useful, that they can get an understanding of, okay, this is what this level means, this is what that level means. How that filters through to decision making, I couldn't tell you, because that's way above my pay grade. But I think we have probably found pretty decent ways, albeit simple ways, of explaining uncertainty to policy.
That's very encouraging.
Yeah, that's optimistic.
Yeah.
Lots of colours. They like colours. It's good.
Yeah. Yeah.
How much information can you fit into one graph?
Yeah,
exactly the amount of coloured lines you can fit onto it.
So
pretty much, yeah.
The follow up to that I would be quite interested in is so okay, you have things like model parameters that are vaccine effectiveness, so 80%, 90% effective vaccine, and you get a different line for this, and this is quite understandable. But when it comes to kind of what we might call model choice or model selection, where you have where the assumptions are very, very different. You might have a model that works on the assumption that things spread on some sort of network, or you might have a model that assumes, I'm thinking here again about the foot and mouth. I think there was a prominent model that assumed radial spread of the disease. I'm not too sure on my facts here.
That would be my model, but yes.
Okay, right. Okay, so but how do you think because I would imagine that communication of these types of things to politicians, and particularly the implications of those assumptions, would be much more difficult. So how do you think that has been working recently, and maybe foot and mouth as well?
Yeah, and I would say that doesn't really happen at policy level. I think generally that's actually where SPI-M and our colleagues are most useful, because I would say that we actually serve to kind of regulate each other, as it were. So, during SPI-M meetings, you can have discussions of model assumptions and model structure and so forth. And I think this is where perhaps, the SPI-M meetings, and also in terms of the escalation process, that we can act as kind of a filter. So things will only get escalated to policy if we have assumed, if it's sort of passed that test, as it were, that we have sort of peer reviewed each other, deemed that the models are sort of appropriate enough and accurate enough to be escalated through SPI-M. But I think at the point that they go through to policy, that communication of what the model structure is, that just isn't done. I mean, it's there in the documents. And often, with the documents that will get escalated to SAGE, the model assumptions are there for those that want to read them. But I couldn't comment on whether anyone actually does.
Yeah, that's interesting what you say about SPI-M kind of, sort of self-regulating in that sense, in that like the assumption or how it's meant to work is that whatever comes out of SPI-M has kind of sort of already gone through a filter between each other. And it kind of touches on something that we've talked about we've talked about communication with the public, communication with the news, communication with politicians. What about communication with other scientists? So sort of the interdisciplinary, because especially with epidemiology, for example, you have the kind of more clinical side of it, who will be very differently trained to the actual mathematical modelers. How does that work? And does it work well? And
Okay, so that's been a little bit mixed, because so there are other subgroups of SAGE, as I'm sure you're aware. So this SPI-B, which is the behavioural arm of SAGE, and there's various others that have appeared and disappeared at various times. So there's a children's subgroup that I've been involved with that specifically looked at schools, that has the awful acronym of SPI Kids, and so which I think was unofficial, but I think it's almost been adopted now, now these, so SPI-B is very much a separate entity, which is mainly kind of the behavioural arm. But then when these like children's subgroups and various others, like I've been involved in a large events subgroup, and I chair a universities group, and these tend to have multiple people across different disciplines. And so, I've on the universities group that I chair, we actually have one of the chairs of SPI-B as kind of our behavioural expert on it. And I think actually through those subgroups, it's really worked very effectively, actually, in terms of kind of improving communication and collaboration across disciplines. I think the kind of hierarchical and kind of how you would call it, kind of tree structure, if you like, of SAGE doesn't necessarily work quite so effectively, because you don't necessarily speak to each other. But I think through the other subgroups, it has worked better. I've had a bit of a challenge, actually, because a lot of my research interest has been looking at optimal controls, but not just considering direct impact of COVID. So including non-COVID health and including kind of economic harms. And I've presented this to SPI-M a few times, and sort of have been unofficially told that really SPI-M's role is very much about COVID, and we shouldn't really be thinking about economics, which is something I find a little bit frustrating, because if actually we want to think about the optimal policy, if you know, again, I'm sure I don't need to tell both of you, right? If all you care about is COVID health and nothing else, then the optimal policy is you stay in lockdown forever, because that will minimize the risk of people dying. In reality, we don't want to do that, right? You know, at some point, you need to increase your risk of people dying from COVID slightly, because there are other benefits to come from unlocking. And so that's why it's really important to take more of a cross-disciplinary perspective and include other things like economics. But we were told that kind of, you know, there are experts in the Treasury that look at economics. So I very much had to go down a different route to try to sort of gain collaborations with like health economists, for instance, to push that piece of work forward. But as I said, that's where these other subgroups have a little bit more come to the fore, that generally, if a subgroup is formed to look at, say, successful reopening of football stadia or whatever, you do need people from various different disciplines. We've had someone, for instance, Professor Kath Noakes, who's kind of really an atmospheric scientist, really, who works on like aerosols, and kind of ventilation and these sorts of things. So I've worked with her quite a bit. And that's worked really, really well, actually. And I think probably the interdisciplinary collaboration through these subgroups has been really effective, actually, in the last few months.
That's very encouraging, because I can't remember who it was who told me the anecdote that for a university, if you want to have any interdisciplinary work done in a university, then you need to create a new department, which is the fusion of the two people that you want to speak to each other. So yeah, that's quite encouraging.
Yeah, that's right. Because you're touching on quite a lot that we've found, especially like working in an interdisciplinary. If you're in applied maths, then you're probably interdisciplinary, or at least try to be, or at least get told to be. And it kind of feels like you get told that, and it's very easy to appreciate that it's useful, but it's not so easy to actually implement it yourself, because you find the barriers when you're doing it, right? Like you kind of have a different language to them. There's some sort of language barrier. There's, as you say, the kind of more bureaucratic barrier. It's really interesting to hear you talk about that these subgroups have actually helped to alleviate some of those. How was it for you crossing that language barrier? Was there so much of a language barrier or communication barrier, or how have you found that?
I mean, I suppose I'm in a slightly different position from some, because I've been working in sort of practical infectious disease modeling for quite a few years. I've got a field project out in the Philippines, for instance, on rabies, that's in hospitals, collecting data, interviewing patients who've been bit by dogs, for instance. And so I've been very used to, I've got a project on avian influenza that's involved kind of working out in Bangladesh and in Thailand with experts in very, very different disciplines. So I think I've been quite used to, for a really long period of time, communicating to people from different disciplines. I think, some others on SPI-M have come from very much more of a theoretical background and haven't had those kind of real world contacts, and maybe have found it a little bit more challenging. But I think I've been, pretty used to, for quite a few years now, going into, government agencies in another country and having to present my work in a way that is digestible, that they can understand. So I don't think this has been particularly different, other than, ironically, probably through SPI-M, sometimes having to sort of talk to my colleagues about the need to make sure that we communicate our work in a way that is understandable, because, as I said, some others are maybe not quite as used to doing that.
Yeah, I guess, they're doable, but it takes practice, and so should be practiced as being a message for younger applied mathematicians, that it does take practice, but it's something that's worthwhile.
Yeah, and I think sometimes, we've had some presentations that we've done where, mentioning no names, but some of my colleagues will spend a really, really long time on the methods and assumptions page and go into very, very fine details about it. And you might do that in a maths department talk, but actually when you're presenting it in those certain environments, you don't want to do that. All the information is there. You should clearly not hide that information. It's very important that it's in the document. But if the document's circulated to people, actually, what you really want to do is give a very brief overview of that and then really focus on the results. And then obviously you can make sure you caveat, you put in a bunch of caveats at the end, but you need to be very, very careful how you present it, because really what you want to focus on is kind of the sort of the high level results when you're presenting it, that really are the take home messages. And then, as I said, the full details are there so people can scrutinize what you've done.
Yeah.
Yeah, there's certainly a balance there, isn't there? Because just as you were saying with the assumptions, for example, it's very important to kind of, as a researcher, digest which of those assumptions the person that you're communicating with ought to know or ought to be actually shouted at with, rather
absolutely.
than kind of leave as a sort of, if you want to read it, then you can read it.
Yeah, I mean, you're right, Ian, and that's why you have to be very careful with it. And that's why I think we would always, with our documents, we always put as kind of a caveats at the end to say, this is based upon this assumption, and to make it really clear that there is uncertainty around this. But for example, so what you don't need is to say, is to go into detail about what distribution you've used for each of your parameters every single time and actually explain all of those one at a time. That's the kind of thing I mean when I say you don't absolutely put it into your method so it's there, but really, focus on the results. But also, as you say quite rightly, Ian, you focus on the caveats and the impact of the potential impact of these assumptions on your model results, which is also really, really important. And that's sort of, leads to another issue, that you do need to be very careful with that. And it makes something that I'm very, very aware of, that something I present to SPI-M like today may end up on the front cover of the Telegraph in a few days' time. So you need to be, and again, it's another thing that probably I'm still not really quite used to. There's a huge sense of responsibility here, that you do need to make sure, it goes back to what we were saying before, you do need to make sure you appropriately communicate your uncertainty and your assumptions, because what you really want to avoid is seeing a figure incorrectly interpreted on the front cover of some national newspaper.
Yes, absolutely. I wonder if we've been discussing the responsibilities of applied mathematicians over time, and how perhaps as we move, I suppose epidemiology is, I don't know. Well, can you tell us anything about the history of maths being actually heavily applied in epidemiology? I mean, going back to 2002, clearly that we were active in advising government then. Were we seriously active in advising anything about epidemiology 30 years before that, or?
I mean, not really. I would say, 2001, the foot and mouth outbreak is really the first major instance where models played a significant role in policy. Since then, I think there's been much more of a platform. I think there's, 2007 with the small outbreak we had for FMD in Surrey. Then we had swine flu in 2009. Obviously, then we had the Ebola crisis in 2014. So I think it's much more in the consciousness of government now that models will be involved in the decision making. But I think probably it really only started seriously with FMD 2001. There may be others before that I'm not necessarily as aware of, but that was certainly the first high profile instance where models were heavily involved in advising policy.
Yeah, so we wonder whether the mathematicians in academia have kind of, as a community, got used to the new set of responsibilities, which it's not uncommon now to have as we advise and take a role in these kinds of things. I mean, it's not just policy making either. As we become more active in the social sciences and these kinds of areas, it's different to being a consultant to engineers or physicists in the responsibilities that you have. So part of what we're interested in doing, I think, is to try and have that conversation and wondering about whether we've really caught up in that regard.
Yeah, so I think there is a responsibility. I think there's another issue actually that I've come across in that, in the last 12 months, anyone with a vague kind of quantitative background has seemed to have the idea that they're an expert in epidemiology. And we've had this a few times where, policy have picked up on some model that's been developed by some person that really has no expertise whatsoever. And you actually manage to finally get your hands on this document, and you see that it's riddled with errors. It's riddled with kind of crazy assumptions. So, for example, you will both know about what an SIR model is, right? And in the simplest term, an SIR model, you have susceptibles, you have infecteds, and you have recovereds. That is clearly not an appropriate model framework for COVID. It's much more complicated than that. We know that age is a factor. We know that we have asymptomatic individuals. We know that obviously people are incubating the virus for a period of time. Some people go into hospital, and then obviously now we have some people are vaccinated, but not everyone is immune. There are a whole bunch of different things you need to incorporate to actually have an accurate COVID model. There are also regional variations in terms of parameters that you need to take into account. So whilst it's grounded in the idea of an SIR model, the true model structure is much more complicated than that in a lot of these sophisticated models. You also need to fit them to the data, which, can take an awfully long time and is very, very complicated. Some people have got the idea that they can model COVID with an SIR model and have done so. And some of these have ended up in the hands of people who actually may be able to influence decision makers. And it's really, really frustrating that we've had to push back numerous times to say that you may think that an SIR model captures what's going on, but it completely doesn't. And it's been quite concerning at times that some of these models, as I say, developed by people who have no background whatsoever, may somehow end up filtering into policy consideration. So I think it's a responsibility not just for those of us that work on infectious diseases, but also for those people with a quantitative background who may think that modeling epidemics is easy, to be very, very careful if they are going to develop one of these kind of back of the envelope models. Yeah. Sorry, that was a bit of a rant from me, but it has been quite frustrating.
No, yes,
fair warning.
Imagine,
yeah,
yes. It's really interesting, and I guess maybe finally we can just sort of reflect on as young researchers. Sort of, we touched on this interdisciplinary aspect, the communication aspect. How do you envisage, as a young researcher, you might go about trying to develop the skill sets that are needed to sort of tackle / mitigate these problems?
You know what, I think it's much more in the consciousness actually of for young researchers of the idea of interdisciplinary research. I think when I went through my PhD, I think we were quite siloed in that you very much kind of worked on a particular discipline. And I think the way that applied maths is going, and particularly with a lot of the doctoral training centres at the moment, is the big focus is this interdisciplinary research. And we're kind of generally training our new generation of PhD students with this idea of working with maybe external partners, for example, and having much more of a perspective of, thinking not just about developing their maths, but actually putting that maths into real world context. So, I'm quite optimistic about it. I think it is important that we, that we expose our PhD students to communicating in non-academic settings. I think that's extremely important, sort of trying to step back from their maths every so often and do thinking about the real world implications. But I think we're in a good place. I think the other important thing actually that I find is a bit more media training. And I think that's been particularly obvious in the last 12 months that, none of us have any media training. We're totally making it up. And we don't also have support really if things go wrong. And I think actually that's very important for our young researchers, that if applied maths is going to become much more in the public consciousness over the next kind of 10, 20 years, I'm very aware of, our young scientists. And I have some great PhD students and postdocs who've done some fantastic work and who have been absolutely, massively influential in terms of informing sort of COVID-19 control in the last 12 months. But I'm always really wary about I would never discourage anyone from doing media because I think it's really important, but I always worry about kind of the wolves coming out for them, as it were. And so I think it's very important that, if our PhD students and postdocs are going to go and do media, that they are aware of that and they have the suitable support when they do that. I think that's really important. As I said, I will say that most of my media experience has been extremely positive, but because I've been burnt by it, I just really worry if our young researchers are exposed to that and end up kind of, front cover of a newspaper or front page of the BBC website being misquoted. Because I think that's particularly in COVID times where you're in isolation, I think if you start to get horrible hate mail and you're not used to it, it's really, really hard. The first time it happened to me, I had a horrendous weekend and it was really horrible. And really, I had no one to talk to about it. And sorry, this sounds like a cry for help, but, it was, in a sense, in the longer term, I'm thick-skinned enough that I can cope with it. And now when it happens, I'm all right with it. But I think actually, if it's the first time you've had to deal with it, it's really horrible. Yeah. And I think we just need to prepare people for that possible eventuality.
That's
really good insight. Really good insight. Thank you so much.
No problem. I hope that was okay.
Yeah, it was really helpful. I think this is a wonderful thing for us.
Yes.
and definitely for hopefully for some of our colleagues to listen to.
All right, well, it's good to talk to you both. Yeah, I'm really sorry.